Could your external hip rotation be impacting your ability to progress with pelvic floor relaxation? We're going to find out in this video. So we're going to start by doing a little test called the Faber test. Now, a physiotherapist can do this for you with a goniometer, or they can use other methods in order to measure the range of motion on your hips. But of course, you may be at home and you may not be with a physiotherapist. So this gives you the ability to do a little test yourself. So set up your camera to actually record yourself doing this, and that will allow you to see your progress on both sides. To test the external rotation of the hips, we can do the Faber test. But before we do that, you can also just check to see how are you when you sit cross-legged. So if you struggle to sit comfortably in a cross-legged position, if your legs are up here, that can be an indication that you have an issue with external hip rotation, because it's the external rotation of the hips that allows the legs to open when you sit cross-legged. So let's do our little Faber test. So for this, we're going to lay down flat. You can bend the right knee in towards the chest, flex the foot, place the foot on the thigh of the opposite leg, and then just try to allow the leg to open. Now, if you have problems with external hip rotation, your knee will be quite far from the floor, and you can see here that my knee is more than a thumb and a fist away, because on the right side I have issues with external hip rotation. So the exercises that we're going to do will help with that. You can do the same test on the opposite side. So take the knee into the chest, flex the foot, rest the foot above the opposite knee, let the leg hang down, and you will see that there is still a little bit of room to go here, but I am much more open on the opposite side. Now, when you do the test, make sure that your hip isn't lifting off the floor. And of course, you can repeat these tests in order to verify after you've done the exercises that you've gained a little bit more range of motion. But ideally, you would go to see a physiotherapist, and they can do these tests with a goniometer, preferably a digital goniometer, in order to see what your range of motion is, and they can test again after you've done your exercises. So once you have verified what your hip external rotation is, we're going to do two different things to try to help with opening of the hip. And the first is a little joint mobilization. And in order to do this, you're going to need a band like this. And I would suggest that you get one that has a thick enough strap, and it should be a little bit firm, not too firm. We're going to use the pigeon pose. And as many of you know, we do the pigeon pose in most of the relaxation videos. So this is a really good way to help you to progress a little with that pose. As you know, we do pigeon pose quite a lot in order to reach in and help to relax the pelvic floor. And this is because the muscles that strap your pelvic floor to your legs, so your piriformis and the obturator internus, are attaching onto the greater trochanter, so onto the top of your femur bone. And by moving the leg into the pigeon position, not only are you getting a stretch in the muscles along the back of your hip, but you're also reaching in a little bit to the pelvic floor. So it's a really effective exercise. But if you have limited range of motion around your hips, particularly external range of motion, this can actually impact your ability to get in to reach the pelvic floor for that stretch. So it can be that because you can't actually relax down into the position, you get a little bit of stiffness. So we are going to work on mobilizing the hip and getting into the hip in a slightly deeper way with the pigeon pose. And then once you have done that, you can come back and try the pigeon pose on the mat. So for this exercise, you're going to need the blanket for underneath your knees and a strap. We're going to set the strap up onto something that isn't moving. Now, the reason we put it against something that isn't moving is because we're going to actually pull against it. So let's just choose a little bar here to connect to, get that strap wrapped around so that it's nice and firm. We're going to use the pigeon pose for this, and again, we want to be having a lateral stretch with the band, so your body is aligned with the line of the band. And we're going to come to a pigeon position, so you're going to step the leg in, and with the leg in, you're going to just make sure that the band is nice and high on the leg. And we're going to come forward and come down, and you're going to take that front leg into a pigeon position, so the knee, and then get the leg to come into the pigeon position. Now, from the pigeon position, you can take the leg as far up here as is comfortable for you. So for some people, you'll have a 90-degree angle in this leg, but for others, it may be all the way back here. So do what feels right for you. Just make sure that you feel that little bit of a stretch in the joint here. And you can keep the back knee lifted, and you can just move a little with your hips here from side to side. And this is a really nice way to feel into that hip. And if this feels okay and you think, I could go a little further, you can take the leg up just a little further and again, feel into it. But remember that you shouldn't feel any pain in your joints as you do this. So it's really important not to feel any pain. Be mindful and be careful. Okay. And then we're going to come out of that on this side. We're going to do the same on the opposite side. So for that, I'm just going to twist around and again, take the band around the leg. Again, make sure that the band is right up against the line of the hip. We're going to pull away a little bit with the band. And again, we're going to close that knee and we're going to find the position on the other side. I'm just going to adjust my blanket so that I have something to rest on as I come into the position. Again, with the back knee, you can keep it elevated. Here, you want to just make sure that you take the leg to where it's comfortable. Now, I'm quite restricted on this side, so I'm going to keep the knee all the way down and then just move a little into this. And you just feel on the back side here, a little bit of opening through that hip. So we're just getting a very slight mobilization of the joint. You shouldn't feel any pain in your knees. Make sure that you're listening to your body as you do this. And you can repeat that again on the other side. So coming out, finding your way back in. So it's always good to stand up and get the band on properly before you start. Make sure that you have that line and do use something soft underneath yourself when you do this. So I'm going to come down again. I'm going to take the leg into the position. I'm going to keep that back knee off the ground. If you are putting the back knee on the ground, just make sure that you put something soft underneath it. And just feel that little bit of a stretch. Really nice. Just feel into your hips and enjoy this. Remember, no pain in your knees. And we're going to swap for the other side. So coming up, taking the band onto the other leg, up nice and high. You can move your props if you need to. And just make sure that you have a little bit of tension on the band, coming down, taking that leg into the pigeon position, keeping the back knee off the ground. And feel into this. It's a really juicy movement. Very nice. Listen to your body very gently. That's it. Okay. And then coming out of the position. The next position that we want to do is a position that works on stretching the groin and also opening the hip up to the side. So you're going to need something firm to hold on to. I'm going to use the banister rail here. So you're going to do some little airplanes from this position, starting by lifting the back leg off the ground. So in this case, I'm going to start with the right leg, start with the hips level, and then you're going to open the hips up to the side. And as you open, you really want to feel length and you want to feel a little bit of stretch in the groin. So coming round and opening. Round and opening. And you can hold that open position for a little moment if you want to. 3, 4, and 5. And we're going to change now and do the opposite side. So opening to the other side. So we're going to open and come around level and open, and really try to bring the whole side of your body into alignment as you do this. Open and come round and really feel the opening of the hips and feel the stretch in that inner groin. 4, and 5. Okay, we're going to come back to the first side. So open, 1, 2, 3, 4, and 5. Swap into the opposite side. So start hips facing forward and then twist to the side. 1, 2, 3, 4, and 5. So one more set. So you're going to hold on and then bring your hand onto your hip. You can open the hip out to the side and 1, 2, feeling the stretch in the groin. 3, really opening those hips. 4, keeping the upper leg straight. And 5. Swapping sides, starting with the hips level, twisting to the side, and then 1, 2, 3, 4, and 5. So for your pigeon pose, you're going to come to an all fours position and you're going to bring the left knee forward. So take the foot to the inside and just find your variation of this pose. So it may be that you can take the foot all the way up so that you have a 90-degree angle in the leg, or maybe you're a little bit halfway, or maybe your foot is all the way down reaching to where the other hip is. You need to practice within your own body. But start nice and upright. Try to relax the hip down to the floor. You can place a blanket underneath the hip if you can't reach the floor. And just allow yourself to relax down. So once you've done the active exercises and you've done a couple of little airplanes, you can do a little passive pigeon stretch, or you can try one of the pelvic floor relaxation exercises and see how that goes. So we're not going to spend too long here, just feeling how it is after having done the release. We can come up out of it and we can take the legs around, find yourself back in your all fours position. This time we take the right knee forward and then take the leg out a little and try to relax your hip down onto the floor. Use a blanket if you need to. We will start upright, and if you feel okay upright, then you can come down to your elbows. And if you want, you can take a full relaxing version here, but I'm just going to wait for just a few moments. Ooh, that actually feels really good. This is my tight side. It's always nice to meet your tight side and to relax a little into it. Nice. And then coming up and coming out of the position. And hopefully this will help you when you go to do your pelvic floor relaxation exercises.